Hi, my name is Gracie Menezes and my student ID S316695. Title slide. This presentation is a relative reflective study on the communication and collaboration in health and social care setting in relation to a case study of Mrs. Turner, a 72-year-old woman with a case of dementia at an early stage of the disease. The fundamental professional skills of health and social care is communication, as it supports the principles of safe practice, person-centered care, and teamwork. Lack of adaptation to the needs of the communication process may result in misunderstanding, emotional distress, and poor quality of care like those living with dementia. This presentation is aimed to discuss how communication styles shape the experience of care that Mrs. Turner had and how collaboration practice helped achieve favorable results. In its analysis, both verbal and non-verbal communication are considered and how both forms of interaction need to be changed to accommodate cognitive changes related to dementia. Collaboration between the professionals and family members towards coordinated and effective support. Case study overview. Mrs. Turner is a 72-year-old female that started displaying the symptoms of early dementia during multiple months. Such symptoms were short-term memory lapse, repeating questions, inability to perform familiar tasks, and speech changes, including problems with identifying the right words. This transformation slowly impacted her capacity to communicate well and brought up even more frustration and anxiety. At first, her daughter was confused about those behaviors since she thought that her mother was deliberately choosing to disregard the instructions instead of having cognitive impairments. The major problem that was revealed in the case was the role of communication issues as it impacted the day-to-day interaction of Mrs. Turner. She usually got lost when told many things and defensive when told off. This shows the effect that cognitive impairment may change the way communication is received and a supportive comment coming out as offensive. Verbal communication style. Verbal communication play a crucial role in Mrs. Turner's experience of care. First, the cognitive needs of her cognitive deficit were not accommodated in the verbal communication of people around her. She received several or complicated instructions with a lot of confusion and anxiety. She would be defensive when the errors are addressed directly because she would feel that she was being criticized rather than supported. This illustrates the negative impact of the use of inappropriate verbal communication with people with dementia and results in emotional distress. Verbal communication strategies were adapted as more professionals got to know about the conditions of Mrs. Turner. Communication was made clearer, simpler, and more concise, and the information was presented at a slow rate. These modifications made the cognitive load to be less and gave Mrs. Turner more time to absorb what was being said. This style is an assertive form of communication in which one is firm and certain and yet respectful and encouraging. Assertive communication is best used in health and social care since it is neither overly empathetic nor too clear. Passive communication can be ineffective in giving enough instructions, and aggressive communication can seem to be controlling or disrespectful. Conversely, assertive communication facilitates the comprehension and encourages dignity. Non-verbal communication. The non-verbal communication was also significant in forming the responses of Mrs. Turner to care. The things that affected her interpretation of interactions included eye contact, facial expressions, body posture, and tone of voice, among others. Mrs. Turner seemed calmer and more cooperative when eye contact was preserved, open and relaxed body language was employed, and it was discussed in a soft tone. The role of these non-verbal messages was to support verbal messages and contributed to the establishment of some feeling of reassurance and trust. These interactions made Turner more anxious and defensive. Although dementia patients may have a hard time being able to decipher spoken words, they tend to be sensitive to emotional expression. This implies that non-verbal communication is sometimes more effective than the verbal one. Mixed verbal and non-verbal communication can result in misunderstanding and stress. This study brings out the significance of self-awareness in health and social care communication. The professional should take care of their non-verbal behavior, which might have a serious impact on the emotional well-being of service users. Impact of person-centered care. The person-centered care involves consideration of the needs, preferences, and experiences of the person instead of just concentrating on her or his condition. The communication had a direct influence on the person-centeredness of care provided to Mrs. Turner. Validation was one of the main methods that is, accepting her emotions first and then clearing up the misunderstandings or confusions. This strategy assisted in calming her down, and she felt respected and understood. Communication led to the optimization of care plan to meet the capability of Mrs. Turner by professionals. Carer ensured that she acted independently by breaking down instructions, giving her more time to respond, and speaking in a calm voice. This assisted in saving her dignity and confidence, as they are fundamental aspects of person-centered care. Communication was also used to empower professionals to engage Mrs. Turner in her care decisions and encourage autonomy where feasible. Poor communication may have meant more distress, lack of trust, and independent deprivation. Nevertheless, it is possible to talk about effective communication skills that help professionals to comprehend and address the professional needs of Mrs. Turner. Team collaboration. Teamwork was critical towards giving Mrs. Turner a safe, effective, and person-centered care. The multidisciplinary working team on her support consisted of a GP, a nurse, and a social care and a community support worker who had various professional skills. Professional coordination enabled the team to come up with a common knowledge about the cognitive loss, communication, and emotional requirements of Mrs. Turner. The holistic approach is vital in health and social care, especially the provision of care to the people for complicated conditions like dementia. Effective and coherent communication among professionals empowered early direction of the symptom in Mrs. Turner and proper referral to be assisted. The communication of information also made sure that every team member knew about any changes in her behavior, memory, and communication abilities. This minimized cases of fragmented care where professionals can otherwise operate in isolation. There was also consistency in approach, speech, and support of Mrs. Turner with the help of collaborative communication in daily interactions. Collaboration and shared goals. Teamwork is the multidisciplinary team facilitated the identification of common goals, consensus on the same, and it is successful realization. The goal that Mrs. Turner had in her case were to ensure that she remains independent, enhance her safety, and manage her anxiety associated with early dementia. With the right form of communication, professionals were assured of the realization of such goals by all those involved, including the family member. This mutual understanding assisted in avoiding conflicting styles which would have disoriented and upset Mrs. Turner. Collaborative planning was the introduction of practical interventions. Environmental modification, including the labeling of cupboards and rooms, made the environment of Mrs. Turner straightforward and helped her to perform daily activities on her own. The learning outcome 5 is met by demonstrating her effective communication in a concise form promotes team-based working and the attainment of shared goals. Care will be disjointed without any effective collaboration, which makes it more risky and less favorable. Conversely, the collaborative practice allowed Mrs. Turner to continue being safer, more confident, and more independent in her room. Reflective recommendation. Effective communication and collaboration in health and social care in general and the support of an individual living with a dementia in particularly involved reflective practice as a fundamental element. Considering the case of Mrs. Turner, there are some aspects where the communication and teamwork might be enhanced. A recommendation that should be given is the continuous delivery of the dementia awareness training to the professionals and the family member. As much as good strategies applied in this case, dementia is a progressive disorder. Changes in communication requirements are possibly with time. Continuous training would assure that the staff members would be confident in changing their styles of communication, such as the use of simplified language, right verbal cues, and validation techniques. Education and emotional support should also be used to ensure that they get strengthened on family involvement. Constant monitoring would facilitate the creation of more positive communication, minimize frustration, and build stronger relationships. This practice advocates person-centered care by appreciating the contribution played by family members to well-being of the service user. Conclusion: another aspect of professionalism and family interaction that leads to favorable care results in reflected in the case. The multidisciplinary team allowed sharing information, using similar approaches to care, and the introducing practical intervention to ensure safety and independence of Mrs. Turner.